One organization interested in making communication between doctors and patients better is Health Literacy Missouri. To give us an understanding of the mission of this organization is President and CEO of Health Literacy Missouri, Catina O'Leary. Catina, it's a pleasure to have you here today.
Thanks so much. It's great to be here.
Many of us recognize that literacy is being able to read, but what is health literacy?
So health literacy takes some of those same components of literacy, being able to read, but expands them a little bit into being able to process and understand information. So when people are in the medical setting, whether it's at a hospital or a doctor's office, or even reading information on a prescription or trying to understand health insurance, they have to process a whole bunch of information to know what they need to do. And health literacy is the tools that help them do that, whether it's from a patient perspective of making sure they know what they need to know and how to understand information, or from a provider perspective and helping the doctors, the insurance companies, other people understand how to make insurance information more clear. So health literacy is kind of that gap between what the patient needs and what the provider needs to have a good conversation.
And you work with the organization called Health Literacy Missouri, and you mentioned that there's both a part of the public and about the providers. Can you tell us a little bit about what you do for both of those?
Sure. So from a kind of public, people on the street perspective, things that people need to really understand are, there are a set of requirements in the medical system. Physicians, providers, people tell you what they think you need to know, but they don't always understand exactly what you need to know and what you don't know. So your job as a patient is to really come in very comfortable and calm and have questions ready and be ready to ask questions even when somebody doesn't maybe put you in a position to ask questions. So sometimes at the end of a visit you'll see somebody say, okay, well, do you have any questions, as they walk out the door? And from a patient perspective, you need to say, yeah, I do. I have one question right now. You gave me this piece of paper, but gosh, this doesn't really make sense given what we just said. So what am I supposed to do? So we teach patients to feel comfortable like that. Most of our work, though, is with providers. So we talk with providers about what they do to kind of eliminate a patient's experience and ability to do that thing that we want them to do. So we talk to them about how they speak clearly, how they write clearly, really simple strategies that they do to check understanding. So at the end of a visit, they should say something like, we've spent a lot of time talking. Can you just help me understand that I've said things in a really clear way? What did we talk about today?
And why is it important for you to know what your doctor's telling you?
Well, we want people to do it. So you see in the news a lot of information about hospital readmissions and what that matters, the kind of cost of the system. One of the things we say in health literacy is, part of the reason that people maybe don't do what they're supposed to is they didn't know what it was to begin with. So if we can make sure that they walk out the door and they know exactly what they're supposed to do, that they fill this prescription and they take it twice a day with breakfast and with dinner, the likelihood that they get better in the way that they're supposed to is high. If they don't do those things, it's pretty likely that they're going to show up at the door again and maybe go back to the hospital.
And do you have some suggestions for what a nurse or a doctor can do to help make sure that that happens?
Sure. So some really simple things that we train providers to do is really start from where the patient is. So there's all kinds of stuff that providers know because they've been to medical school or nursing school or whatever. A lot of that stuff doesn't matter to the patients. Patients don't care about the Latin names and why this happened and all the combinations of other complications. They really want to know what they're supposed to do. So if providers can explain really clearly the action steps for patients, if they can maybe draw some pictures, if they can use really clear words, step 1, fill the prescription. Step 2, take the medicine at breakfast. Step 3, take the medicine at dinner. If you can explain those things in a really simple way, people are more likely to do them. And then, as I said, I talked about teach back earlier, this idea that you assess comprehension and understanding before people leave so you know that they have the information.
And if somebody was interested in learning more about what you do, how could they get more information?
Oh gosh, they can find us on the internet. There's all kinds of information at our website. Give us a call, come see us. We would love to talk about it.
Thanks so much, Catina.
Sure.
It's great to know that it's sometimes okay to ask a question.
Absolutely, thank you.